When they walk in that first day, they're, usually very anxious and, very closed and nervous. And by the time they leave, they're waving, they're smiling, they're opening, closing those fingers in their hands. And, they have a confidence to them and the smile on their face. And they're excited of, what all they have accomplished, and they're proud of themselves. And, I'm proud of them too, of all the hard work they put into it. And, they come a long way, and you could see it on their face when they leave. Part of almost everybody's daily life, you need your hand for your bathing, dressing, self-care tasks. You need it for work, your leisure activities, playing golf. That's one of the biggest things. I get a lot of people who play sports, and their biggest complaint is they can't hold a golf club. They can't hold a bat, they can't catch a ball, and your hands are important for all those aspects. So we work on your sport activity, leisure activity. It's not just your function. It's everything that you do, not just a certain function. It's, everything in your life that you do that you need your hands for. I specialize in treating infants all the way to adults. Pretty much anybody that has anything that affects them from living their daily life or affects them from being independent in their daily life is something we will help address. So if you're talking about little kids who have trouble at school with fine motor tasks or holding utensils, to sport athletes or teenagers who have difficulty playing sports, catching a ball, throwing a ball, older adults who are having trouble at work, typing, holding things at work, carrying files, to, elderly patients who are just, having trouble enjoying their retirement years or their life, or, difficulty moving their joints or stiffness or pain. We help address all of that and try to make them as independent in their daily work, leisure, and sport activities. The thing with seniors is that their independence is very important to them. They don't want to rely on other people. They don't want to depend on other people. They want to be as independent as they can in their daily tasks. So with seniors, that we make sure we kind of address their goals, what they want to work on and be more independent on, and kind of address that in therapy with different therapeutic exercises, and educating them on different joint protection techniques, and adapting utensils or anything we need to adapt in their daily life to make them become more independent. So when I have parents of small kids, I always invite the parents to the treatment session. I spend just as much time educating the children or working with the kids as I do with the parents, because it's very important after therapy. The parents are the ones to follow up with their kids, making sure they're, continuing their exercises. So I make sure the parents understand what we're trying to achieve here, what our goals are, and I ask them what their goals are for their child, and we work together, and I educate them and show them what they need to know to help their child at home. We get our fair share of weekend warriors. In the winter season, you have a lot of snowboarders, skiers, a lot of parents snowboarding with their kids or wanting to ski with their kids. A lot of different, people on the weekends lifting heavy things, moving things, athletes. So we definitely get the weekend warriors, but one of the things we do with them is also just educating them also to help prevent some of these injuries, so they could prevent them from ending up here. Different things like with snowboarders is just wearing wrist braces when you're snowboarding to help prevent wrist fractures. It's very common with snowboarders. You either fall backwards or forwards. If you're falling forwards on your hand, you could be susceptible to 2 wrist fractures right there, just landing on your hands. But if you wear the protective braces on your hands and you're educated in that before you do that, you can help prevent having a bilateral wrist fracture. With hand injuries and all injuries, it's very important to have a good relationship with your doctor, because they're performing the surgeries. You want to know exactly what they did and what techniques were done, so you can kind of guide your treatment program accordingly. And pretty much with those situations, we kind of focus on what we need to focus and see what's causing that setback, and we kind of analyze how could we get to where we want to get, what's causing us to, preventing us from being where we want to be, and kind of address those issues as we need to. We have good relationships with our doctors. If we have to call the doctor and, report back to the doctor on how a patient is doing, then, we have good communication with the doctors also. Everything. We treat the whole individual. It's not just we're treating the physical aspect, we're treating the individual as a whole. So anything that is affecting them from becoming independent, and sometimes it's just emotionally adjusting with their injury and their life now after their injury. I love working with people. I love helping people. I love being able to help people kind of go through that transformation and be there with them all along the way and get them to where they want to be. Like I said, like when they walk in and they're nervous and scared, just to be that person to be there and just be like, you're going to be okay. We're going to get you to where you need to be and everything's going to be all right. And we're with you every step along the way. And even when the patient is discharged, I give them my card, my email address, and if you have any questions, concerns, feel free to call, contact me. Like, I'm not just someone who's just there temporarily while you're going through this. We're here with you for the lifetime. When you're in just different safety around the house, that's another thing we do is like home safety also, proper lighting, throw rugs, like just the way things are set up to prevent falls at home. One of the main causes a lot of people come in are due to falls, slipping on ice. So knowing to wear proper footwear when it's icy out or slippery to help prevent falls. Trying not to rush, take your time. A lot of patients like to carry too many bags at the same time, or we're always in a rush to get everything done quicker. Just kind of take a step back and, just be mindful that, you could take 2 trips carrying the groceries. The floor may be slippery, like walk a little bit slower, wear proper footwear. Things around the house, try to not to have too much clutter around the house. Just try to provide and keep a safe environment at home to help prevent some of these injuries.